Hello everyone, Thomas Weimbs here again, this time with Registered Dietitian Nutritionist Beth Zupec-Kania. Did I pronounce that about right?
Did.
Yeah, you're wonderful. So we're here in Switzerland. You might be able to see some mountains in the background. And we're at a Keto live event. And it's really exciting to have all these experts here. And Beth is a very special expert because she has been working on ketogenic metabolic therapies for a long time, and has been really one of the key pioneers, I would say, on bringing, kind of even transitioning ketogenic therapies from where it has been, known for a long time in childhood epilepsy, all the way to so many other conditions, including adult conditions and other pediatric conditions. So maybe should we walk a little bit?
Yeah,
yeah. All right. And I thought I would ask Beth about exactly that. So maybe most of us have heard that the ketogenic diet has been around for 100 years or so for the treatment of childhood epilepsy. And a little bit more recently, I think it has been started to be used for so many other conditions. And what role have you played there? How did you come upon all this?
Yes, well, it was just actually serendipitous because I started out as a pediatric nutritionist working with children that have epilepsy, and specifically children that have difficult to control epilepsy. And the definition of difficult to control epilepsy is if two drugs or more do not control seizures. That's known as difficult to control epilepsy. So the statistics are, if two drugs don't control seizures, the likelihood of a third drug is very, very low.
Right.
And so now in our consensus guidelines, we say this is when you should consider keto, possibly sooner.
Actually, can I just interject one question that's always burning on my mind? Okay, so you have a child with epilepsy. You start the child off with one medicine, one drug. It doesn't work. You go to the next drug. Only then you start considering ketogenic diet. To my mind, a ketogenic diet is a conservative therapy. Why is this not the therapy of first choice?
You and I think very much alike. However, the medical world is very conservative. And so for people
what can
listening,
be more conservative than a diet?
I know.
Right.
Very true. And everybody watching this is like, makes so much sense. Why don't you just start with the diet?
Exactly.
Especially now that we know a very liberal diet, which some people may not even recognize as being keto on a plate because there's a larger amount of carbohydrate and protein and less fat than the classic.
Right.
These kind of diets could be introduced earlier, like a low glycemic index treatment, for example, which is harmless.
Right.
It may not even cause ketosis. So that's a really good point.
Okay.
And one that I actually tell my clients about.
Right.
But the medical community is more conservative than this. So they say if two drugs fail, we should try diet. And certainly there are certain conditions where we know the diet works better. And just to go to the diet, and I could rattle those off. Dravet syndrome is one, glucose-1 transporter deficiency syndrome, pyruvate dehydrogenase deficiency syndrome, to name a few. There's 10, but those are the more common ones. And for those, we know the diet works better than medications. So yeah, this is sort of where we're coming to in the evolution of updating guidelines.
Right.
So we've been talking about children, but I want to tell you that it works just as well for adults.
Right.
And over the 30 plus years that I've been working with this therapy, we've learned that not only does epilepsy usually get better, but sleep gets better.
Right.
And energy level gets better. And while these things are getting better, medications are often being reduced.
Right.
So then health in general gets better. So recognizing that these other symptoms get better is sort of how it's expanded into migraine headache. and
Right.
cognitive disorders
Right.
and psychiatry. And certainly we know there's a greatly expanding focus on using keto in the mental health world for adults. It's actually also being looked at in children, because children can also have depression,
Right.
especially if they have epilepsy or other chronic conditions. So this is the evolution of keto, and the Charlie Foundation got involved because they wanted to spread their word about Charlie, who
Right.
became seizure free, medication free,
Right.
after being on the diet for a few years. They wanted other families to have that experience. And then when we started getting involved with spreading the word and paying attention to the research, and that the research is indicating it can help these other conditions, the Charlie Foundation opened its doors to advocating for all conditions where there's
Right.
evidence that it's beneficial.
A lot to follow up there. I wanted to just real quick show everyone the this beautiful church in the background there. It looks very Swiss to me, right? Yep, beautiful. So we're just walking by that church. Yes, so the Charlie Foundation, so some people might know it already, it might be new to others, but so the Charlie Foundation, so everything started with the personal experience of the director, Jim Abrams, right? And if anyone hasn't seen that key movie yet, which is called First Do No Harm, is that right? Okay.
Yes.
You can get a probably illegal version, oops. You might get an illegal version on YouTube. But it's an amazing movie, so I highly recommend it. And it has to do with a boy named Charlie, is that right?
No, this is a different story. It's
okay.
very similar to Charlie's story,
Right.
but it's a different little boy who had difficult to treat epilepsy.
Right.
He ended up in the intensive care unit,
Right.
and they were going to put him into a coma because he was having constant seizures. And the family had learned on their own about keto, and the hospital would not allow them to try it because they didn't know how to do it and they didn't believe in it. So the family, with the aid of that patient's nurse, snuck out of the hospital and went to Johns Hopkins.
Right.
And they called them in advance and say, can we come in? Our child is very sick. And Johns Hopkins said, please come. They put him on the diet, and that little boy is now a grown man. He's in his 40s. Anyways, his seizure stopped. He became seizure free.
Right.
And he's a healthy man, has lived a very healthy life. And so Jim Abrams got that story from the family who wrote to thank him. And he said, oh, this is movie material, because the family had a lot of drama. They lost their farm because of the medical bills.
Right.
And there was a lot of discourse in the family. So it was a very interesting story.
Okay.
And Jim asked his friend,
That one? I don't know. Good.
his friend and Meryl Streep to play the role of the mother in this
Right.
movie. And so the movie has been out for over 20 years, I think
Right.
25 years. Your library might even have it, or they can get it for you.
Right. Yeah, definitely go watch it. First Do No Harm. Amazing movie. I've watched it a whole bunch of times. And that kind of led then to the formation of the Charlie Foundation, and initially focused on pediatric epilepsy. And since when have you sort of transitioned to also adult treatments and other pediatric diseases?
Yes, it's really been by opportunity. It's been, people have come to us and said, is there information? How can we find it? Where can we go? And we, on the Charlie Foundation website, have a directory of centers around the world who have physicians and nutritionists who implement this therapy. Now, it's not totally inclusive. This is a volunteer information kind of directory, but it's a world map, and you may start there.
Right.
charliefoundation.org, and then go to resources.
Perfect. Yes. And Beth is, as I said, one of the key dietitian nutritionists there. And you're not only you're actually treating patients, but you're actually, maybe even more important, you're training other dietitians. Is that right?
Yes. So I have a program of my own called Keto Mastery. My partner Denise Potter is my training partner, and we've been training for 15, 20 years, but we've gone virtual. So we have this online Keto Mastery program specifically for dietitians who can get credits. Doctors and nurses also take this program, and it's virtual. So you can attend live or you can watch the recordings. And there's a foundational course and an advanced course.
Excellent, yeah. And it always puzzles me a little bit when I hear a healthcare professional saying that keto diet, I've never really heard about it, sounds dangerous, let's not do that. What's missing? It's been around for 100 years. So many different diseases are being treated with it highly successfully. But what is missing? Why does the word not pierce into everyone's brain? What do you make of it?
Yeah, I think more and more dietitians are learning about it because it is in the literature, and they don't have to go very far to learn about it. And there's dietitians then like myself who realize, I wonder if this is going to help me with my symptoms of perimenopause or insulin resistance or whatever, and try it out. And it's very safe for a dietitian to try it out because he or she can get to the resources and do it safely. But there's a learning curve for that. And by the way, here in Switzerland, we want dietitians to come to our Keto Live training programs so they can get immersed in the therapy and learn how to treat others.
Perfect, yeah. And that's a whole other effort, Keto Live, which is why we're here right now in this particular town in Switzerland. I think the Keto Live organization is roping in all the expertise they can get from everywhere, including, you from the Charlie Foundation. So Swiss folks, if you're listening, look into all this. Where can people, you already mentioned it's charliefoundation.org,
Yes.
right? And
Yes.
from there is, I'm assuming, free resources available?
Yes, there's free resources. There's also a store if you want to purchase resources. For example, cookbooks and training books and low-carb product information. A lot of resources that are downloadable or purchasable.
Excellent, wonderful. So I would say reach out to the Charlie Foundation, to Beth, look at the resources that are available. And see if you're a healthcare practitioner, see if you might be able to apply some of these things to your own patients. Good. Thank you so much, Beth. Really appreciate it.
You're welcome. Hope to see you.
Bye.
Bye.